You know that feeling of absolute relief when you finally unhook your bra at the end of the day? That deep breath you take, and the sense that your chest is finally free. That feeling is trying to tell you something important. It is not just about comfort. It is your body telling you that circulation has been restored. For decades, we have been told that we need heavy support, metal wires, and rigid structures to look a certain way or to prevent sagging. But as we enter our 60s and 70s, our bodies change. Our skin becomes thinner, our lymphatic system needs more help moving fluid, and restrictive clothing stops being just an annoyance and starts becoming a health risk. Today, I want to talk to you about why that metal wire sitting against your ribs might be doing more harm than good, specifically regarding your lymphatic drainage, and why it is time to reconsider what you wear for support. I am Dr. Susan Blake, and I am so glad you are here with me on Her Health After 60. We are going to have a very honest, private conversation today about breast health and comfort. I've also added a helpful guide to the Senior Health Guide app linked below. Now let's dive in. Before we get to the science, I have a quick question for you. When you take off your bra at night, do you see red marks or deep grooves left behind on your skin? Let me know in the comments, because those marks are a major clue we will discuss shortly. Let's start with the basics of what is happening under the surface of your skin. Your breasts are not just tissue and fat. They are part of a very complex, delicate ecosystem involving your lymphatic system. Think of your lymphatic system as the body's waste disposal crew. It picks up toxins, cellular waste, and extra fluid, and flushes them out of your body. Unlike your blood, which has a heart to pump it around, your lymph fluid does not have a pump. It relies entirely on your movement, your breathing, and gravity to flow. Now picture where an underwire sits. It usually traces the bottom of the breast and curves right up toward the armpit. This area, specifically the armpit or axilla, is rich in lymph nodes. These nodes are the collection centers where all that fluid from the breast tissue is supposed to go to be filtered. When you wear a rigid metal wire that presses tight against your ribs and digs into the soft tissue near your underarm, you are essentially stepping on a garden hose. The water, or in this case the lymph fluid, cannot get through. It backs up. I want to share a story about a woman named Margaret from Ohio. Margaret is 68 years old and has always been very diligent about her health. She came in because she was noticing a lot of tenderness in her breast tissue, and she felt what she described as a heavy, full feeling that wouldn't go away. She was worried naturally, thinking it might be something serious. We did the exams, and thankfully, everything was clear medically. But the discomfort persisted. I asked Margaret to show me the type of bra she wore every day. It was a very sturdy, heavy-duty underwire bra that she had worn the same style of for 20 years. I suggested a simple experiment. I asked her to switch to a soft, wire-free camisole or a medical-grade compression bra for just 2 weeks. No wires, no rigid seams. Margaret was skeptical because she felt she needed the support, but she agreed. When she came back 2 weeks later, she told me the tenderness was almost completely gone. The heavy feeling had vanished. By removing that constant pressure barrier, her lymphatic fluid could finally drain properly, reducing the swelling that was causing her pain. Stay with me here, because this next point is crucial. When lymph fluid gets trapped in the breast tissue because of restriction, it can lead to chronic inflammation. Over time, this fluid buildup can make the breast feel lumpy or painful, a condition often called fibrocystic breast changes. While usually benign, it is uncomfortable and can make it harder for you to perform self-exams because the tissue feels dense and uneven. The underwire is often the culprit because it creates a semicircle of blockage. Think about the anatomy of the rib cage for a moment. Your ribs are designed to move. Every time you take a breath, your ribs should expand outwards. When you exhale, they contract. This movement acts like a bellows, helping to massage the lymph nodes and push fluid through your chest cavity. If you have a stiff metal wire clamped around your torso, you are physically restricting that movement. This brings me to another patient I spoke with recently, Elena from Italy. Elena is 72 and has always been very fashion conscious. She loved the shape that her underwire bras gave her and wore them from morning until night. Elena started experiencing upper back pain and a feeling that she just couldn't take a deep breath. She thought it was her lungs or maybe her posture. She visited a few specialists who looked at her spine and her lungs, but they didn't find a root cause. When we looked at her daily habits, we realized her bra was so tight and rigid that she was breathing shallowly, only using the top part of her chest because her rib cage literally couldn't expand against the wire. We transitioned her to a wire-free style that relied on fabric tension rather than metal for support. Within a week, Elena noticed she was sleeping better and her back pain had subsided. She was finally breathing deeply again, which in turn helped her lymphatic flow improve. It is important to understand that the metal wire was invented a long time ago, in a different era of clothing manufacturing. It does not account for the fact that a woman's body changes shape throughout the month and certainly throughout the years. As we age, our layer of subcutaneous fat, the cushioning under our skin, thins out. A wire that might have felt fine when you were 30 or 40 is now pressing much closer to nerves and bone. This constant pressure doesn't just block fluid, it can irritate the skin itself. Under the breast is a warm, moist environment. When you add a metal wire encased in fabric that rubs against the skin for 12 or 14 hours a day, you create friction. This can lead to rashes, fungal infections, and even skin breakdown. I have seen many seniors with dark, discolored lines under their breasts, almost like a permanent bruise. This is actually a form of hyperpigmentation caused by chronic inflammation from the pressure. Listen closely, because this is a sign you need to watch for. If you take off your bra and the red marks stay there for more than 20 or 30 minutes, that bra is damaging your tissue. A little indentation is normal with elastic, but deep red grooves that look angry or irritated are a warning sign from your body that the blood flow and lymph flow in that area were severely compromised for hours. We also need to talk about the tourniquet effect. You would never wrap a rubber band tightly around your wrist and leave it there all day, because you know your hand would swell. Yet, we do this to our chests. The lymphatic vessels in the breast are very superficial, meaning they sit just under the skin. They are not deep inside the muscle. This makes them incredibly easy to compress. It does not take much pressure to close off a lymph vessel. Even a well-fitting underwire exerts enough pressure to impede this flow if it sits in the wrong spot, or if you sit in a slumped posture, which presses the wire deeper into the abdomen and ribs. Some women worry that without a wire, they will have no support. This is a myth. Modern fabric technology has come a long way. We have access to fabrics now that offer incredible lift and containment, using varied weaving patterns, encapsulated cups, and wider bands that distribute weight across the whole back rather than focusing it all on two narrow strips of metal under the breast. I want to introduce you to a third story, this one from Sarah in Florida. Sarah is 65 and lives in a very warm climate. She was dealing with recurring cysts under her breasts. They were painful, red bumps that would flare up in the summer. She was using powders and creams, but nothing worked long-term. The issue was that her underwire was trapping heat and moisture, and the pressure was preventing the hair follicles and sweat glands in that area from draining. It was a mechanical problem, not an infection problem. Once Sarah switched to a moisture-wicking wireless bra, the cysts cleared up. The area could breathe. There was no hard object grinding dirt and sweat into her pores all day. It seems like such a small change, but for Sarah, it improved her quality of life significantly because she was no longer in constant, stinging pain every time she moved. Now, I want to clarify something about the lymphatic system and gravity. Many people think the bra supports the ligaments, preventing them from stretching. While there is some truth to supporting the weight of the breast, the wire itself does not do the heavy lifting. The straps and the band do. The wire is mostly there for shaping. So you can give up the wire without giving up the support. You are essentially trading a cosmetic shape for a functional health benefit. Pay attention to this part. If you have ever had any surgery in the chest area, or if you have any heart concerns, this becomes even more critical. The chest wall needs to be free to move. We have seen that restrictive clothing can actually increase heart rate variability in a negative way because it adds a subtle layer of stress to the body. Your body has to work harder to breathe and circulate blood against the resistance of the garment. Let's talk about how to check if your current bra is a danger to your lymph nodes. Put your bra on and lift your arms over your head. Does the wire dig into the side of your breast tissue? Does it poke the armpit? If the answer is yes, that wire is directly compressing your axillary lymph nodes. These nodes need to be free to swell and shrink slightly as they do their job filtering waste. If they are pinned down, they cannot function. Also, feel the side of the bra. Is there a plastic boning or a stiff seam on the side? Sometimes even wireless bras have these rigid side stays to prevent rolling. These can be just as bad as underwires if they are positioned right over the lymph channels that run down the side of the torso. The transition away from underwire can feel strange at first. You might feel uncontained or different. This is normal. It is a sensory adjustment. Your body has been trained to equate that tight, hard pressure with support. But real support shouldn't hurt. Real support should feel like a firm hug, not a pinch. I often tell my patients to look at their skin tone after removing their bra. It should look even. If you see pale patches surrounded by red, flush skin, that indicates that blood was squeezed out of that area. That is ischemia, a lack of blood supply, on a micro level. Over years, this damages the collagen in the skin, actually making the skin looser and less elastic, which is the exact opposite of what you want. We also have to consider the materials that often cover these wires. Many affordable bras use synthetic fabrics that don't breathe well. When you combine a non-breathable fabric casing with a metal wire, you create a perfect storm for bacteria. But beyond the hygiene aspect, the rigidity affects your posture. When something digs into your ribs, you subconsciously slouch to pull away from the pressure. You might find yourself rounding your shoulders forward, just to create a tiny bit of space between the metal and your skin. This protective slouching creates a chain reaction. Your head comes forward, your neck muscles tighten, and your diaphragm, the big muscle under your lungs that helps you breathe, gets cramped. Because deep breathing is the main pump for your lymphatic system, this posture effectively turns off the engine that moves fluid through your chest. You are double locking the door. The wire blocks the path, and the bad posture stops the pump. I want you to think about how your hands feel after a long day. Do you ever get tingling or numbness in your fingers? Believe it or not, this can be related to your bra. When an underwire bra doesn't fit perfectly, and very few do, we tend to over-tighten the shoulder straps to compensate for the lack of support from the band. This digs into the soft tissue on top of your shoulders. This brings me to our next story, involving a woman named Clara from Toronto, Canada. Clara is 63 and loves to knit. She came to see me because her hands were going numb after only 20 minutes of knitting. She was worried it was arthritis or carpal tunnel syndrome. We looked at her shoulders and found deep, permanent grooves where her bra straps had been digging in for years. By tightening the straps to keep the underwire in place, she was compressing the nerves that run from her neck down to her hands. This is a bundle of nerves called the brachial plexus. I advise Clara to switch to a bra with wide cushioned straps and, crucially, no underwire. Without the heavy metal frame, the new bra relied on a wider band around the ribs to carry the weight, taking the pressure off her shoulders. Within a month, the tingling in her fingers had reduced significantly. She could knit for an hour without pain. The problem wasn't her hands. It was the heavy infrastructure she was wearing on her chest that was cutting off her circulation and nerve signals. Don't miss this, because it is a simple change that makes a huge difference. If you have indentations on your shoulders, you are carrying the weight of your breasts entirely on your trapezius muscles, which are prone to stress and tension headaches. A wire-free bra with a broad back band shifts that load to your rib cage, which is much stronger and better designed to handle it. Now, let's talk about what happens when you sleep. I know some women feel they need to wear a bra to bed for support. Please, if you take one thing away from this video, let it be this. Never sleep in an underwire bra. Your lymphatic system does its most important work while you are sleeping. This is when your brain and body detoxify. If you restrict the chest area for 24 hours a day, you never give your tissues a chance to recover. Gravity works differently when you are lying down, and a rigid wire can shift and press into breast tissue in ways it doesn't when you are standing up, potentially causing blocked ducts or cysts. If you must wear something to bed for comfort, choose a soft cotton camisole or a specific sleep bra that has zero compression. It should feel like a second skin, not a cage. We have talked a lot about the problems, so let's focus on the solutions. What should you look for? You want a bra that offers encapsulation rather than compression. Compression smashes the breast tissue flat against the chest wall, which isn't comfortable or flattering for many seniors. Encapsulation means there are cups formed by fabric molding that hold each breast separately without a wire. Look for labels that say wireless, soft cup, or leisure bra. Material matters just as much as shape. As we age, our skin becomes drier and more sensitive. Synthetic lace and stiff nylon can be scratchy and irritating. Look for cotton blends, bamboo, or modal. These are natural fibers that breathe and move with you. Bamboo is excellent because it is naturally antibacterial and incredibly soft against thinning skin. I want to share one final story with you from a patient named Betty in Oregon. Betty is 78 and has struggled with heartburn and acid reflux for years. She was taking medication, but it wasn't fully controlling it. She noticed that her reflux was always worse in the afternoon. We realized that her underwire bra was sitting right over the top of her stomach. When she sat down to relax or eat, the wire dug into her upper abdomen, putting physical pressure on her stomach valve. Betty decided to try going braless at home and wearing only soft camisoles when she went out. The result was remarkable. Her reflux didn't disappear completely, but the afternoon flare-ups stopped. She wasn't physically pushing acid back up her esophagus with a metal wire anymore. She told me she felt lighter, not just physically, but emotionally. She hadn't realized how much low-level anxiety that constant tightness was causing her until it was gone. This leads me to a practical step you can take right now to help your lymphatic system. It is a simple massage technique you can do yourself. You don't need to be an expert. It is called dry brushing or gentle skin stretching. Here is how you do it. First, use your hand to gently stroke the skin from your breastbone out toward your armpit. You are not massaging deep muscle. You are just moving the skin. The lymph vessels are right on the surface. Do this 10 times on each side. Imagine you are smoothing a wrinkle out of a bed sheet. That is the amount of pressure you need. Very light. Next, place your hand flat in your armpit. Gently pump your hand by pressing in and releasing, almost like you are pumping a soap dispenser, but slower. Do this 5 times. This stimulates the lymph nodes in the axilla to wake up and start accepting fluid. This is wonderful to do right after you take off your bra in the evening to get things moving again. I also want to give you a movement exercise to open up the chest wall, because years of hunching over to protect ourselves from tight clothing can make us stiff. Please stand near a sturdy counter, a wall, or a heavy chair for this next part to keep your balance. Stand up tall and interlace your fingers behind your back if you can. If you can't reach, Just hold a small towel between your hands behind you. Gently straighten your arms and pull your shoulders down and back. Lift your chest toward the ceiling, but keep your chin level. Take 3 deep, slow breaths into your upper chest. Feel the rib cage expand. This stretch counteracts the curled forward posture that tight bras encourage. It physically opens the space where the lymph nodes live, allowing them to drain more effectively. I want you to hear this clearly. It is not giving up to stop wearing underwire. It is evolving. It is choosing to treat your body with kindness. There is a huge industry designed to make us feel that we must have a certain silhouette to be presentable. But health is beautiful. Comfort is beautiful. Being able to take a full, deep breath without pain is beautiful. If you're worried about how clothes will look, try on your outfits with a new wire-free bra. You might be surprised. Many women find that because they aren't constantly adjusting or pulling at their bra, they actually carry themselves taller and with more confidence. That confidence shines through more than any lift a metal wire could provide. Start slowly. You don't have to throw everything away today. Buy one high-quality, wire-free bra. Wear it for a few hours around the house. See how your skin feels. Check for those red marks. Notice if your breathing feels deeper. Your body is very smart. It will tell you what it prefers if you give it the option. Remember, your lymphatic system is your silent guardian. It protects you from infection and keeps your fluids balanced. The least we can do is remove the roadblocks that make its job harder. By freeing your chest from restriction, you are investing in your long-term heart health, skin health, and immune health. It is a small change in your wardrobe that yields a massive return for your well-being. As we wrap up, I want you to look at your bra drawer with fresh eyes. Ask yourself, does this garment serve my health, or does it serve a habit I formed 40 years ago? You deserve to feel comfortable in your own skin every single day. If videos like this help you, hit subscribe to Her Health After 60 and tap the bell so you never miss a tip. To recap, underwire bras can block lymphatic drainage, irritate aging skin, and even affect your posture and breathing. So try switching to wire-free options and doing gentle chest stretches to restore healthy flow. Even small daily steps can help you feel steadier, safer, and more confident as you navigate your 60s and beyond. This video is for education only and is not personal medical advice. Always talk to your own doctor about any pain or health changes.